Welcome back to Frequently Asked Questions about Tattoos with Wes. I, of course, am your host, Wes. What sort of illnesses or disease processes will prohibit me from getting tattooed? Or just medical conditions in general. So there's a couple basics here. If you're pregnant, you don't want to be getting tattooed while you're pregnant. The big thing is this is trauma to you. And occasionally we do have people pass out. So while you're carrying a little bambino in the little bun in the oven, as it were, your job is to be in as best shape as possible and administering a tattoo, getting a tattoo that's um, trauma that you don't need at that point in time. So save your great idea for after the child is born healthy and got 10 fingers and 10 toes, but we do not tattoo pregnant people just because of that trauma to the skin. Your heart rate, your blood pressure, all those sort of things are going to move up and down while you're getting tattooed, and that could affect the fetus. So that's why we don't tattoo pregnant women. Diabetes is another big one that we don't. Well, we tattoo diabetics. What we want is a note from your doctor because, again, we're tattooers. We're not medical professionals. So if your doctor says and you have diabetes, you're cool to get tattooed, absolutely bring your doctor's note in, and we're happy to tattoo you. And that's typically the case. The reason we can't just carte blanche tattoo anybody who has diabetes is one of the side effects of diabetes is a lowered ability to heal yourself, especially on end of appendages. But nonetheless, you can have problems healing. And what we don't want that turning into as an infection or something more catastrophic if that infection gets out of hand. So if you're a diabetic type 1 or type 2 and you want to get tattooed, so you don't waste your trip or lose your deposit on your tattoo, I suggest ahead of time getting a note from your doctor that says absolutely Jane Doe or John Doe is cleared to get a tattoo. It's all good. Another thing that we is classic is anything with some version of an immune disorder. Again, this is an abrasion. This is a wound of some variety. We want you to be able to heal. And if you have an immune deficiency, again, we're glad to tattoo you, but your doctor is going to know you particularly better than we are. So again, we request a doctor's note. If for whatever reason you have some other medical instance and you're in and it's in doubt whether or not you're going to be able to get tattooed, call your doctor and just ask for a note. If it's not a big deal, they will be glad to send you a note. Blood thinners is another one. I know my father, when I tattooed him and he was in his 70s, was on blood thinners. He talked to his doctor. Doctor said, absolutely, you can get tattooed. What we're going to do is we're going to take you off blood thinners for 3 days, which is fine. And this is the doctor saying that. We're going to take you off blood thinners for 3 days, let that blood thicken up a little bit. You're going to go and get tattooed. And then the day after, you're going to get back on your blood thinners. So when in doubt, ask your doctor. But for sure, we're not going to tattoo you if you're pregnant. If you have risk of blood clots, if you have diabetes, if you have some immune deficiency, we're glad to tattoo you. We just need to have a doctor's note saying you personally in your situation are good to go. Hope this helps. Cheers.